According to the World Heart Federation, heart failure affects around 64 million people worldwide and is the leading cause of hospitalizations. In Malaysia, an estimated 6 to 10% of hospital readmissions are due to heart failure. IJN recently organized its first heart failure conference aimed at facilitating knowledge sharing among medical professionals regarding to management of heart failure. The two-day event, which was held at the Kuala Lumpur Convention Centre, gathered around 450 medical experts. The conference covered several topics such as heart failure management, electrophysiology, imaging, genetics, current advancement in heart failure research and clinical practices, and best contemporary practices in patient care. In his welcoming speech, IJN CEO Datuk Dr. Aizai Azan Abdul Rahim stated that the conference aimed to generate a new paradigm for better heart failure management. The conference also saw the announcement of IJN's plan to set up a Center of Excellence in Cardiovascular Health in collaboration with Medtronic. The Clinical Center of Excellence will facilitate treatment, care, and research around cardiac and vascular diseases. The partnership also involves joint capacity building efforts to introduce new therapies and provide training around cardiac and vascular diseases.
According to the latest clinical practice guidelines on the management of heart failure, published by the National Heart Association of Malaysia in 2019, heart failure is a significant cause of hospitalization. It makes up between 6 to 10% of acute medical admissions in local hospitals, and it is also a significant cause of readmissions as well. Given the complexities of heart failure management, from handling patients' comorbidities and keeping track of multiple medications, my hope is that the conversations that we will be having over the next 2 days will generate new paradigms for all of us. I'm very pleased to announce our latest initiative being carried out in partnership with Medtronic, in which we'll establish a Center of Excellence for Cardiovascular Health on the basis of equality and mutual benefits. With this Clinical Center of Excellence, we hope to build on our past successes to push for further progress in the cardiovascular field and to deliver more value to our patients.
The Heart Failure Conference was a great success, providing a platform for healthcare professionals to learn about the latest developments and advancement in heart failure management, advanced heart failure, structural heart intervention, and physician Dr. Jeremy Kwa Wai Jin said that the conference welcomed everyone professionally involved in the field of cardiology to promote a better understanding of heart failure.
For heart failure in Malaysia, we are doing fairly well now in terms of providing guideline-directed medical therapy and providing evidence-based therapy compared to 1-2 decades ago. However, we have still much to improve. We are still lacking in resources, logistics. We want to achieve equity of care for the rural and urban areas. So there is definitely imbalance there. And the access to knowledge and technologies. So people have to gain access to our available technologies here that we can. So we want to offer our expertise and our treatment options, which is in line with the best evidence in the world to everyone. So that's the whole idea. So in line with the World Heart Federation core values, which they're looking at care, equity, community, integrity and aspiration. So the idea now is to reach out to our local community, and we want to ensure that everyone has equity of care. That's very important. That means all patients have the same access to advanced heart failure therapy, which we have in IJN, with the only center that provides transplant and LVAD. We have to ensure that everyone has the access to the education, to knowledge, and it has to be shared, So that's important. So in the end, reaching out to community, to the local community, is a very important aspect, and then subsequently to the public. Public awareness is very important. So I think that would be in line with what our World Heart Federation is aiming to achieve. In the end, we truly want to aspire to be a very strong community, and the network between the public sectors, doctors, and even key policymakers are important. As a whole, if we are able to create that family, and then I'm very sure that we can move forward from there. Now we are accepting trainees, we are accepting doctors from other states in Malaysia, even overseas. We have been training on a regular basis doctors from Philippines, Indonesia, people outside or international, on international scale. IJN is being recognized. People know that we offer that kind of services and we are good in what we do. We have high volume of cases, so therefore people are sending their doctors to be trained with us, with our respective experts in that field. And that's what we are doing. We're undergoing very regular training programs. And we hope that we also can reach out to a local platform, local doctors, and by encouraging that, I believe that we can reach a level where we have a very strong network of doctors who are all trained in this field of heart failure. One of the key areas that we want to venture in would be to organize outreach projects to rural areas in certain states, and then reaching out to the patients there, meaning ensuring that they also gain access to the healthcare that they deserve. And I think that we can do by networking and basically arranging logistics and with proper manpower, which we all can provide.
Sponsors for the conference includes Abbott Medical, AstraZeneca Malaysia, B. Brown Medical Supplies, Boehringer Ingelheim Malaysia, Boston Scientific Malaysia, Medtronic, Pfizer Malaysia, and many more. The conference is just one example of IJN's commitment to advancing heart health care in Malaysia and beyond. With that, we end today's Heart News. My name is Mariam Azmi. Thank you for watching and don't forget to subscribe.